Good morning. Please remain standing for our national anthem. Good morning. I'm just so thankful to be here and so happy to see each and every one of you. I am Julie Byerly, and I have the honor and privilege of being the president of Geisinger College of Health Sciences and the dean of Geisinger Commonwealth School of Medicine. Today is our 2024 Medical Doctor Commencement Ceremony, the 12th graduation of our medical school, and what a joyous occasion it is. I am joined on stage by the leadership of Geisinger, members of the board of directors, the college executive committee, and representative faculty, staffs, and alum. We are so pleased to have our distinguished keynote speaker and honorary degree recipient as well, the U.S. Surgeon General, Dr. Vivek Murthy, here with us. But we are most excited to celebrate you, our 2024 School of Medicine graduates. For you and the loved ones here to support you, this ceremony is for you. Thank you. I love the ritual of graduation, not because of the pomp and circumstance, the regalia, or even this fine medallion and hat. But I love a graduation because of the opportunity a ceremony provides for us collectively to pause and reflect. The students know I love a reflection. So students, I ask you specifically, and I invite each and every one of us here today to pause for a quiet moment to reflect and on all that brought you here today. I invite you to take a deep breath, even close your eyes if you might, and remember back to a time in your life when you did not even know to expect that this day would come. Then, reimagine parts of your journey, some of the challenges, some of the triumphs. Breathe in with confidence, humility, and pride the fact that you are sitting right here, right now, about to celebrate the crossing of this stage and the accomplishment of becoming a physician. I'm so proud of you. You, our graduates, will be joining the proud cohort of Geisinger Commonwealth School of Medicine alumni. And today, that number tops 1,000 new physicians. Just think about that. Thanks to the work of our many founders, faculty, staff, support from individuals, the community, and of course, support from Geisinger, there are now 1,000 new doctors ready to care for people and populations in need of our attention. As a young medical school, we still have more than 2/3 of our alums in their graduate medical education training. But 48 physicians are already independently practicing in the Geisinger region. After this class walks across the stage, we will have graduated 69 psychiatrists and 345 primary care doctors, as well as some of almost every specialty in need. Our programs have inspired thousands of young people in our region to consider health careers. In fact, our pathway program, Reach High, has succeeded, with 27 of today's 115 graduates having participated in that pathway program in some way. That's amazing. And thanks to our transformative Abigail Scholars Program, where Geisinger invests to cover the cost of education for students who promise to return to Geisinger as employees in needed specialties, there are 66 alums who we expect to return to employment at Geisinger over the next 5 years after they complete their training, including 37 of you in this class. And then there will be at least 40 more of the subsequent classes currently enrolled at GCSOM each year. Our medical school is making a tremendous impact on our community, and you are each a part of that. Thank you. Now it is my pleasure to welcome to the podium one of our greatest community champions, Ms. Virginia McGregor, Chair of the Board of Directors of Geisinger College of Health Sciences and Geisinger Commonwealth School of Medicine. She also serves on the Geisinger Health Board of Directors, the Quality Committee, and is chair of the Geisinger Family Committee. In addition to her role at McGregor Industries, a family-owned business that is a manufacturer of structural steel products, she serves the community in many, many ways as a volunteer. She is a fierce champion of this region and of its crown jewel, our medical school. We are so grateful for her leadership. Welcome, Ms. McGregor.
Thank you, Dr. Byerly, and we are so grateful for your leadership as well. And thank you, Dr. Murthy, our Surgeon General, for coming all this way. I'm really looking forward to your remarks. As Dr. Byerly said, I am a fierce advocate for Scranton, Pennsylvania, and Northeastern Pennsylvania, and everyone who comes from here, including all of you. When you drive around our communities, you probably notice a number of cemeteries, which is part of our tradition. But it tells a story about how we have been dying of the same diseases for generations. My grandmother, my mother's mother, died of a stroke when she was 62. My mother also died of a stroke, but at age 87. My grandfather, my dad's father, died of cancer when he was 50. My father, after a bout with cancer, lived to 76. Those extra 25 years that my mom and dad outlived their own parents by made a huge difference. Imagine getting an extra 25 years with the people that you love. That longevity was provided in healthcare, which was created by just like doctors like you who brought that innovation to our communities. Doctors like you delivered the message to their patients about how they could live longer and stay healthy. It was my mother's doctor who came to her and said, "Your mother had a stroke when she was 62, and here is what you need to do in order to be proactive about your life." Because her doctor was compassionate and he had empathy, he knew her history. He was looking out for her best interests. And when you look at Geissinger's Commonwealth School of Medicine graduates, you are looking at the best. And that is because of your training. You saw models like the Fresh Food Pharmacy, which aims to improve lives through education on nutrition and healthy lifestyle choices. You learned about Geisinger at Home, where you went into patients' homes, saw the environment they lived in, and understood how you could provide personalized care. Of course, the demands on your time are different today than they were back then. But one thing that has stayed constant is this: the very best doctors lead with empathy and caring. Keep in mind that innovation comes from doctors and how they practice, but that innovation is driven by empathy and understanding the whole person. And that builds the kind of trust that influences and saves lives. As you go out into the community to build that trust with your patients yourselves, always remember your roots at Geisinger. You will always be welcome back home. My husband Bob and I were blessed with a new grandchild just 13 days ago. We can clap for that. When I held little Bobby McGregor in my arms for the first time, the first thing my daughter-in-law and I talked about was the advice she got from her doctor. And I could remember clearly that advice that I got from my pediatrician when I was also a young mom. When I had the first of my 6 babies 36 years ago, I trusted my doctor to help me and my husband take care of this precious child. I still remember what Dr. Frank Swift told me on my first appointment and how it carried me through, and I remember it to this day. That's what a good doctor does. Doctors like you are going to hold the future in your hands. At the end of my mother's life, her doctor gathered all of her 11 children together and said, "It's time to say goodbye." And we trusted him. A good doctor's care from the first day of life to the very end is a gift. We are all so grateful for the advice, compassion, and support that we have received from good doctors in moments of joy and sorrow. In other words, when a physician is empathetic and caring, we remember them. So I ask you this: will you be that doctor that your patients will be grateful for? I think you will. Congratulations, graduates of 2024. It's now my sincere pleasure to welcome Dr. Jae-Won Ryu. Today, he is CEO of Geisinger. Tomorrow, he is CEO of Risant Health, a new nonprofit designed to bring accessible and affordable care to more communities in America, of which Geisinger is an inaugural member. We expect great things will come from this partnership, and we are so grateful for all that Dr. Ryu has done for our community's health and longevity. Dr. Ryu?
Thank you so much, Virginia. Dean Byerly, staff, faculty, and honored guests, it's a pleasure to be with all of you today. I'm especially honored to share the stage and welcome our keynote speaker, Dr. Vivek Murthy, the U.S. Surgeon General. That's a special treat for all of us. Thank you so much for joining us. And to our graduates and the families, congratulations. Your Geisinger education has prepared you well for the future. And hopefully you are excited, as we are, to see all that holds in store for you. At Geisinger, you learn to put the patient first, and that lesson will never fail you. Never stop asking, what does my patient need? Where do they need it? Sometimes it's not the hospital. It can be the clinic, it could be the home, these emerging places where people can and should be getting care to advance their health. How can we ensure both the best care and the most effective prevention? How do we deliver good health, not just great health care? Sometimes what the patient needs is someone who understands them, understands and can see when and where there may be barriers to them achieving their best health. Those insights can be powerful medicine as much as any drug or technology can be. I am hopeful that the Geisinger focus on understanding and addressing social determinants of health has prepared this class to lead the change necessary across medicine. As a Geisinger graduate, you've dedicated hours to community service. It's a key part of what you all have learned and achieved and helped and given back. And you've researched ways to improve population health. No matter where you go, seek to apply these lessons to benefit everyone. You really can make better health easier. Now I also want to welcome Geisinger's president and new CEO, Dr. Terry Gilliland, who you're going to hear from here momentarily, as we go through this leadership transition that Ms. McGregor alluded to. Dr. Gilliland is someone I've known for a number of years, but just a quick background on him. He did his bachelor's at Stanford in biology and then went on to receive his MD at UCLA, where he was sitting in the very seats that all of you are sitting in today. And then also went on to do his Master of Science in Management at the Stanford School of Business. Prior to joining Geisinger, he was the Chief Scientific Officer at Cogitativo, which is a data science company exploring the uses of artificial intelligence and machine learning to augment how care can be transformed in this country. And prior to that, he served in various executive roles on the payment side and the delivery side, whether it was at the Blue Shield of California or the Centera Health System in Virginia. Dr. Gilliland has been in your seat before. He knows what this day holds in store for all of you and your families. He began his career as a general surgeon, and from there really has worked at each and every level to transform the healthcare within this country. So with that, I want to welcome Dr. Terry Gilliland.
Well, thank you, Dr. Rue and Dr. Byerly, and welcome, Dr. Murthy. It's such a pleasure to be here. To staff, to faculty, thank you, and for graduates and families, congratulations. It's an incredible day in your life. You will never forget it. As J1 has said, I'm so happy to be here as part of the Geisinger family, and in particular, one of the reasons that I came is because of Geisinger School of Medicine and the incredible programs that you have experienced in these last 4 years and now are ready to meet the world. And so as a part of that, I would say, of course, congratulations, and with this degree, there's a certain amount of privilege and there's a certain amount of responsibility. And so we are counting on you to do a couple of things. First, with all these tremendous advances in artificial intelligence, augmented intelligence, gene therapies, you will have an incredible career, and it will be full of new things and advances that we're looking forward to see you deliver. As part of that delivery, we'd ask a few things. First, drive value. We all need better outcomes, collectively, individually. Second, work hard to get upstream to prevention. As Virginia has noted, she's had a radical view of how things can change in healthcare when prevention works upstream towards better health and is part of Geisinger's value of making better health easy. Third, work to be that professional that others look up to and want to be like, the sense of professionalism. And finally, be sure to work in teams, because it's those teams that are delivering healthcare with you that really drive to those better outcomes. I'm so pleased for you. It's a pleasure to be here. And the next speaker is Adam, who, as you know, is from Fort Lauderdale. He's heading to Pittsburgh to train in anesthesia. He's your class president, and as of today, he's Dr. Adam Watkins. Please welcome him.
Thank you, Dr. Gilliland, for that introduction. And our distinguished faculty, esteemed guests, beloved family and friends, and most importantly, graduates, good morning. I had afternoon written to you all. It's an immense honor and a pleasure to have all of you here with us today. My name is Adam Watkins, and I'm the class of 2024 Student Council President, and it is my honor to speak to all of you today on this momentous occasion. With the time I've been given to speak, I wanted to, much to the frustration of my classmates, I'm sure, and to the satisfaction of Dean Byerly, I want to reflect over our last 4 years. And I promise, I have the script here. I don't think there's any more reflecting happening, as far as I can tell, so this might be the last one. But you'll see our class is no stranger to reflections, as we have had countless assigned reflections throughout our medical school curriculum. While these weren't everyone's favorite assignments, I personally enjoy reflecting, and I believe it serves a unique purpose for anyone reaching a transition point. It allows us to not only identify components of our journey that led to where we are, but also to adjust our future behaviors based on what our reflection provides us. And when I reflected upon the last 4 years and our collective class experience at GCSOM, I found one theme that pervaded: hope. And while I think hope is a defining characteristic of the experience of many over the last 4 years, I'd like to specifically articulate why I think that's the case for our class. See, our class was in a unique situation when we started medical school. Many of us were moving to a new city, in a new state, and starting an arduous curriculum surrounded by new people in the midst of a global pandemic where our health and the health of our loved ones was called into question. We saw and experienced the tumultuous shifting of public health policy that directly affected our day-to-day lives as students. We subsequently faced a curriculum overhaul at our medical school, of which we were the first students to experience. We saw new leadership at the school and transformation in the directorship of many courses. We had additional modifications with a novel clinical campus placement process and students pioneering new clinical campuses. We faced national changes to medical education with the advent of national board score alterations and introduction of the dreaded signaling to residency applications. It really seemed that we were facing uncertainty and change in almost every aspect of our lives as students, but yet hope was palpable in our class. And how was this hope palpable? Well, I saw hope immediately in how our classmates welcomed one another with warm kindness in our first days, even if it was virtually over Zoom. Over the next 4 years, we encouraged one another through sharing study resources and practically supporting one another in difficult times, even helping a classmate move after they were evicted and their house burned down all within 6 months. And yeah, that was the same student, unfortunately. He's a trooper, though. Hope was additionally evident in how our class pioneered new clubs, organizations, and research endeavors, aiming to professionally support one another. It was evident in how our classmates aimed to lift up their communities, both locally and abroad, through awareness initiatives and fundraising. And it was evident in the intentional pursuit of camaraderie and kindness that we continually displayed towards one another throughout our 4 years. And now, having reflected upon our time and identified this hope that is woven into our experience, I wanted to encourage the class of 2024. I specifically want to encourage you to hold on to this hope and to let it inspire each of you as you move into this next stage of training and life. I encourage you to hold on to this hope during dark days of residency when it feels like you can't go on. I encourage you to let this hope drive you to compassion and kindness with your patients, even when there are a plethora of other factors making it difficult to do so. And I encourage you to let hope permeate into your life and into your relationships and everyone you cross paths with, family, friends, and colleagues. So with all this being said, I want to thank you for giving me the opportunity to speak today, and I want to again extend a heartfelt congratulations to the class of 2024. I'm immensely proud to call you my colleagues and friends, and I hope that you can all hold on to hope in residency and beyond. Thank you. I would now like to introduce our alumni speaker, Dr. Jordan Chu, a member of the class of 2019. Dr. Chu is a native of Old Forge and is presently practicing pediatrician at Society Hill Pediatrics in Philadelphia.
Thank you, Dr. Adam Watkins, right? And welcome to the Alumni Society. Amazing message you just delivered, and we actually have some overlapping themes, so I hope I can deliver some encouraging words to your class that may last with you guys, something that you can reflect upon and draw strength from. So good afternoon to everybody, to our esteemed faculty, our proud family members, our proud friends, and most importantly to you guys, our graduating class of 2024. Today is a day of celebration and a day of reflection, a day to honor your incredible journey that you remarkable individuals have been on, at least in the past 4 years, but more so in the 20+ years that have led you to this point. It's really with great honor and great humility that I get to stand before you today as an alumnus from the class of 2019. So I finished pediatric residency 2 years ago, and I'm currently an outpatient pediatrician in nearby Philadelphia. But I remember like it was yesterday, my life was much different when I was just in your shoes. Correct me if I'm wrong. Wake up, go to class, eat lunch, more class, little break, study, go to the library, more class, and study, dinner break that I often took at my family's restaurant, Osaka, if you guys know. (244) Adams Avenue. Then back to studying. Maybe you went to the gym, but you went home, went to sleep, wake up, next day, repeat. And depending what day of the week it was, or depending what year it was, maybe you had anatomy class, maybe you had a rotation you were on, or maybe you were just overwhelmed, just sick of everything, and you were crying in your mentor's lab, in your mentor's office. We've all been there. I was. And today we're surrounded by your friends and your family and your faculty, and I truly am deeply moved by the significance of this moment. Each one of you truly has poured your heart and soul into reaching this milestone. You endured countless hours of studying, moments of self-doubt, and I'm sure many sacrifices that you wish you could have back. But you're here, and you made it. But your journey isn't over yet. You're opening up a brand new chapter of your journey. Residency. And for some of you, even maybe most of you, this chapter of your journey will be the most challenging yet. It definitely was for me. Those 24-hour shifts, those long weeks of nights, more feelings of self-doubt, insecurities, imposter syndrome, fatigue. It just adds up and it adds up and it adds up and it adds up. Eventually, it manifests as depression. And for me, it even manifested as a desire to give up. It did. But now I'm here, and I made it. So just like Adam said, there's hope. There's definitely hope. With that being said, I want to share with you something very personal with you all today. It wasn't because of me that I made it. Not at all. It wasn't because of myself that I made it. During this grueling part of my journey, I found strength and guidance in my faith. That faith was in God. It was because of Him that I'm here, not because of me. I'm not here to preach God to you. I'm not here to preach religion to you. Not at all, not at all. I'm here to encourage you to draw strength on your own faith, whatever form it may take. Because to me, faith in its purest essence, it's a beacon of hope. It's a beacon of hope in times of darkness. It's a source of comfort in moments of despair. and it's a guiding light among the path not well traveled. And so for some of you, like it does for me, faith, yes, it does manifest as a belief in a higher power. It does. For others, it may be found in your friends, in your family, in your loved ones, in your children, in your community. But maybe it just may manifest as the shared humanity that unites us all. And as you go into residency, you will definitely be constantly reminded of the miracles of life, but also, sadly, the fragility of our existence. You'll definitely witness both moments of despair and moments of weakness and moments of heartache. And it's during these times that our faith can serve as that beacon of hope and a reminder that we are part of something that's greater than ourselves. Your role as physicians extends way beyond medical treatments. Remember, you have an amazing privilege. This is a true privilege to be a part of another person's medical health. You can affect someone medically, mentally, emotionally, and maybe even spiritually. So as you embark on this next chapter of your lives, remember to embrace that privilege with gratitude and humility. With that, I just want to say one more thing that one of my attendings said to me once, and it really hits me hard. So as you take care of your patients, seek connections with them. Seek connections with them beyond their illnesses. Listen to their stories, hold their hands, and be present. Just be present in their moments of vulnerability. Congratulations to you guys. May God bless you abundantly in your journey. And I know you can be that beacon of hope and that pillar of faith for somebody who needs it more. Thank you.
Hello, I'm Bill Jeffries. I'm the Vice Dean for Education and Provost of our college. And I am pleased to present to Dr. Byerly and to the Geisinger Commonwealth community our commencement speaker, Dr. Vivek Murthy. Dr. Murthy was confirmed by the U.S. Senate in March of 2021 to serve as the 21st Surgeon General of the United States. As the nation's top doctor, Dr. Vivek Murthy helped to advance the health and well-being of all Americans and has worked to address critical public health issues. He has issued Surgeon General advisories on the youth mental health crisis and social media's impact on youth mental health, the epidemic of loneliness and isolation, and on burnout in the health worker community. Dr. Murthy also issued a Surgeon General's framework on mental health in the workplace, and he is the first Surgeon General to host a podcast, House Calls with Dr. Vivek Murthy, where he invites guests and listeners to explore how we can all build more meaningful and connected lives. As Vice Admiral of the U.S. Public Health Service Commission Corps, Dr. Murthy oversees more than 6,000 dedicated public health officers serving underserved and vulnerable populations. Dr. Murthy previously served as the 19th Surgeon General under President Obama. Raised in Miami, Dr. Murthy received his bachelor's degree from Harvard, his medical degree from Yale School of Medicine, and his master's in business administration from the Yale School of Management. Dr. Murthy has used his far-reaching platform as Surgeon General to advocate for population health issues that Geisinger has made central to our mission.
Dr. Murthy. On behalf of the Board of Directors of Geisinger Commonwealth School of Medicine, the faculty of the school concurring, I confer upon you the degree Doctor of Arts, honoris causa, and invest you with the rights and privileges pertaining thereunto. and in token thereof, I hand you this diploma. Thank you.
How's everyone doing today? It is so good to be here, and on what a special day as well. I'm so grateful to Dr. Byerly, to Ms. McGregor, to Dr. Rue, for all of the leadership here of Geisinger, to the faculty and staff, to the families here for this warm welcome. And I'm most of all grateful to you, the class of 2024, the people who were here to celebrate our nation's newest doctors. What an incredible moment this is for you, for your families, and for all of us. This is a milestone, as we've talked about, but for me, it's a particularly important milestone because it brings me back to my own medical school graduation, which is a special moment in my life. One of the things I remember most about that day was taking the oath, that sacred Hippocratic oath. That oath that you will take today is not just an oath for a few years or for as long as you practice medicine. It's an oath for life. It's a promise to care, to serve, and to heal, not just in the clinic or in the hospital, but everywhere and at all times. And it's a sacred commitment to humanity that is now part of your identity and that now connects you to healers all across the world. That desire to serve and to care, the desire that brought you to medical school, that's actually the same inspiration that brought my family halfway across the world to America nearly 45 years ago. My grandfather was a poor farmer in a small village in India where he grew tamarind and rice and coconuts. And he was barely scraping enough together to feed his family, his 6 kids, and to clothe them and send them to school. But somehow, despite the bracing poverty that they lived in, my father found a way against all odds to go to medical school. And despite having little money or few connections, he and my mother made their way to the United States. They opened a primary care clinic in Miami, Florida, which is where I grew up. And it's where they taught me that medicine was about so much more than diagnoses and prescriptions, that it was about building relationships and serving a community. Watching them is what inspired me to become a doctor. My parents left everything that they knew to come to America, not because they believed that our country was perfect, but because they wanted their kids to grow up in a nation that aspired to the ideals that every person mattered and was deserving of opportunity. And despite all our challenges and heartbreaks as a nation, I stand before you fully aware that in few other countries in the world could the grandson of a poor farmer be asked by the president to look out for the health of an entire nation. That is the power and the promise of America, and I will always be grateful for it. Now, I realize that 4 years ago, many of you did not have an in-person graduation from college, and that was because of the pandemic. For you to have persevered and learned everything from pharmacology to the pathophysiology of heart disease, to how to care for a patient, interview them, and do a physical exam, and come up with an assessment and plan, to do all of that, despite the chaos of COVID-19, that's a testament to your dedication and to your strength. And I'm grateful for it, not just because it got us to today, but because you are needed now in our country more than ever. There are major forces that you read about every day in the papers that are pulling medicine in different directions today. Tech innovation and artificial intelligence, dramatic expansions in our scientific knowledge, the consolidation and restructuring of healthcare systems, and major policy initiatives that affected everything from coverage to cost. But the real question is what impact these will ultimately have, and whether they ultimately lead to better lives for patients will depend on whether there are people in hospitals and clinics and town hall meetings and lawmaking bodies who are grounded in the sacred values of patient care and who can help guide and shape these forces. You now are these people, along with millions of other clinician colleagues that you now join across the nation. And for all the changes that may come in medicine during your lifetimes, there is one thing that I remain certain about, and that is that there is no technology that will ever make you unnecessary as a doctor. AI, artificial intelligence, it can improve healthcare, and I'm sure that it will. But a machine cannot sit by the bedside and hold your hand. It cannot understand as you do the complex ways that love and loss affect our patients and how that shapes how we communicate with them about a new diagnosis or treatment. Caring for another human being is and will always be a profoundly human endeavor. As you embark on this journey to become a doctor and to serve as a physician, one of the most important tasks that you're going to face is how to protect your well-being and how to nurture your humanity. Your humanity is what allows you to empathize and care for a patient as a human being and is more than a set of lab values or imaging studies. Your well-being is what protects you against burnout and emotional depletion. Now, there is one factor, it turns out, that is at the heart of our well-being, at the heart of our humanity, a factor that seems to make all the difference between fulfillment and unhappiness, a factor that grounds us and enhances our health at every level. It's not wealth or fame. It's not publications in prestigious journals or academic tenure. It turns out to be our relationships with one another. The Harvard Study of Adult Development, which has been following participants and their descendants since 1938, has found that the single most important predictor of health and happiness is good relationships. And many other studies have found the same. Yet for too many people today, these kind of relationships have become more scarce. Last year, I issued a Surgeon General's advisory on our epidemic of loneliness and isolation to call attention to the fact that nearly half of adults are living with loneliness, and the numbers are even higher among young people. Our social disconnection is now contributing to depression and anxiety, to heart disease and dementia, and to an increase in mortality that is on par with smoking and obesity. Many of us actually know this in our guts. Chances are that we or people that we love have struggled with the pain of loneliness and isolation. As doctors, you will certainly encounter loneliness in your patients and your colleagues, as I have over the years. So today, I'd like to offer you 3 stories that have taught me about what's at the core of building meaningful relationships. Stories that I hope will help you as you set about building a more connected life. The first story is about being present. When I was a medical student, my classmate's father had to undergo emergency surgery. Now, thankfully, he did okay. But as budding doctors, we had lots of questions. Who was his favorite clinician? We asked our friend, keeping in mind that we were all trying to figure out what kind of doctor we wanted to be. Was it the internal medicine doctor who was skillfully managing his multiple medical conditions? Was it the nurse who spent the most time with him? We were surprised to learn that it was, in fact, his surgeon. It's not because he spent the most time with my dad, our friend told us. Because the surgeon would come by at 6 a.m., would wake her dad up, and would spend about 5 minutes with him in total. But it was what he did in those 5 minutes that made all the difference. He sat on the bed next to his patient. He held his hand. He looked into his eyes. He asked him how he was and listened deeply to the answer. He examined the surgical site with tender care. Those 5 minutes felt like half an hour to my friend's dad. It was his favorite time of the day. Yet today we're often distracted when we're with others. Our attention is siphoned off by notifications, the news, our inbox, and just the sheer habit of checking our phone all the time. I've fallen prey to this as well, stealing a glance at my inbox while talking to a friend, or checking my phone at times even when I'm spending precious time with my kids. Sometimes, though, we have to disconnect to truly connect. So the next time you're catching up with a friend or having dinner with your family, put your devices away and give them your full attention. Remember that your presence has the power to stretch time, to make 5 minutes feel like half an hour, and to leave someone feeling seen, heard, and valued. The second story is about being real. Being real is about being open and honest. It's about being vulnerable, even though that takes courage and can feel risky. In 2017, my life changed overnight when my first tenure as Surgeon General ended abruptly. I was suddenly separated from the work I loved and the colleagues that had become family, and I had no idea what to do. Unfortunately, I had also lost many of my ties to family and friends over the prior 2 years. It was the cumulative effect of many, many small moments of putting work ahead of the people that I loved. Now I was ashamed to ask for support when I hadn't exactly been there for them. Even when I would see people, I wouldn't really talk about what was really going on. I didn't talk about the deep loneliness, the shame and self-doubt that kept me up at night, the fear that I no longer had any value to add to the world. One day, a friend recognized what was happening, and she said to me, "Vivek, you have friends, but the problem is you aren't experiencing friendship. You need to tell people what's really going on." I knew she was right. A few weeks later, I summoned the courage to talk to two friends, Sunny and Dave. It turns out they too were also quietly struggling with feeling alone and lost. So we made a pact to video conference once a month to talk about the issues that were deeply affecting us, our fears and our dreams, our joys and our disappointments. We also began checking in regularly on a group text thread and doing spontaneous calls whenever one of us wanted to talk. We called ourselves a moai, a reference to an old Okinawan tradition where a small group comes together and makes an explicit commitment to have each other's backs. And over the next year, that moai changed my life. Being honest and open allowed me to breathe again. I felt lighter. I started to laugh again. I began to forgive myself and to look forward to the future. The moai also helped me navigate critical life decisions about family, health, and work. At one point, I was offered a prestigious job. Yet Sunny and Dave helped me realize that it was actually my insecurity that was driving me to consider the offer, and not a sense of genuine excitement. Thanks to them, I said no. Had I not, I would have never been able to move to Miami and see my parents delight in the company of my young children for 18 months. I would never have been able to embark on writing a book about a topic that really did excite me, social connection. I wouldn't have been able to say yes when then former Vice President Biden asked me to help him navigate a novel virus that was spreading rapidly around the world in March 2020, an experience that was deeply meaningful to me and ultimately brought me back to serve as Surgeon General. Being real with Sunny and Dave helped me find my way out of the darkness. And because they were real with me about their lives, I came to understand an important truth, that life is messy for all of us, without exception. We may walk around with masks that conceal our pain. We may have resumes that look like everything was perfect in our lives. But it's our moments of authentic sharing that draw us closer and allow us to heal. The third story is about the power of showing up. During the summer after sophomore year of college, my family and I made a terrible discovery. We learned that a man that we had trusted for years as a close family friend was actually an international con artist. When he abruptly fled the country, he did so with our entire life savings. We felt betrayed, angry, and deeply ashamed. To make matters worse, we received word that the medical office where my parents had cared for so many patients with devotion, the office where I found my original inspiration to become a doctor as well, this had been taken too, and we were about to be evicted from our own clinic. We drove to the office as fast as we could to gather our records and belongings, the whole way fighting back tears. When we got to the office, we were stunned to find a small group of family friends waiting for us at the door with boxes and tape. They heard what was happening and they wanted to help. For the next hour, we sat side by side, packing up a lifetime of memories. There was no judgment, no scorn, no awkward questions. There was only a resolve on their faces which said, "We've got you." I will never, ever forget that. In the months that followed, our friends saw us through one of the darkest periods of our life. They didn't wait for an invitation. They showed up. They listened. They helped. Most of all, they reminded us that we weren't alone. At a time when our souls had a tear in it, they patched us up with their acts of love. That is the power of showing up. Be present. Be real. Show up. These are the 3 keys to nurturing relationships that will sustain you for the rest of your life. My son and daughter, who are 7 and 6, remind me that we actually know these lessons from the earliest days of our lives. If you watch small children carefully, you'll notice that they focus on what's in front of them. They don't pretend to be somebody that they're not. And their instincts are to show up with empathy and with care. I was reminded of this recently when I was at the dining table and my daughter playfully tossed a toy toward me. I lunged for it and immediately felt an excruciating pain lance through my shoulder. Turns out I had a frozen shoulder. Didn't fully realize it. And those of you who've had a frozen shoulder know just how painful that can be. I dropped to my knees. My eyes were squeezed shut, and I was just waiting for the pain to subside. And that is when I felt a small hand rest on my shoulder. I felt a small head lean against mine. And I opened my eyes, and it was my son. You see, nobody taught him how to show up and care. He was born knowing, just as all of us are. Our instincts might be buried under layers of worry, of cynicism, of fear, of being hurt in the past. But those instincts are still there if we are willing to reach for them. I want to leave you today with a practice that I turn to during those inevitable moments in my life, in all of our lives, when self-doubt and loneliness surface. I want you to hold up your right hand like this. I want you to place it over your heart. And I want you to close your eyes. Think about the people in your life who have supported you on your journey to this moment. Your dear family, your close friends, your treasured mentors, the people who have been there with you to celebrate your moments of joy, who have also showed up during your times of disappointment and pain, the people who stood by you when you lost faith in yourself, and who reminded you in those moments about who you are. Feel their love flowing through you, strengthening you, guiding you, and filling you with peace. Know that you are deserving of this love, and that love is always there for you, whether they are here or not, because it resides within you. Now, open your eyes. What you felt in those few moments was the power of love. Love is the world's oldest medicine. It is what I wish for you more than anything else in the world. Your ability to give and receive love is your greatest gift and your greatest power. It's what will sustain you on every step of the journey ahead. Congratulations, class of 2024. I wish you all a lifetime of happiness, of fulfillment, and joy.
That was such an inspiring message. We're so grateful for the honor of having Dr. Murthy here with us today. It was truly an honor and privilege. And now it is my pleasure to call upon Dr. William Jeffries, Geisinger College of Health Sciences Provost and Vice Dean for Education, to present the graduates. And as the graduates process, please note the special stoles, cords, or medallions denoting some of our student groups. For example, students self-identifying as first generation to college are wearing a blue stole with lettering. Medical Research Honor Society program graduates who have achieved the distinction are wearing a medal on a green ribbon with their regalia. Abigail Geisinger scholars are wearing a medal with a white ribbon on their academic regalia. Members of Alpha Omega Alpha Honor Society are wearing green cords, and Gold Humanism Honor Society members are wearing gold cords. Graduates who have participated in our Reach High or Center of Excellence programs are wearing silver stoles, and Physician Legacy students are wearing green stoles with their regalia. That is, of course, if they all chose and remembered. These student awards and distinctions have been previously celebrated, and the students are listed in the program booklet with a symbol denoting each honor. Certainly, we are proud of each and every one of the graduates about to cross the stage. Dr. Jeffries.
Dr. Byerly, I have the distinct privilege and honor of presenting the recipients of the degree Doctor of Medicine. These individuals have satisfied the requirements established by the faculty and have been recommended by the faculty and approved by the Board of Directors.
As president of Geisinger Commonwealth School of Medicine, upon recommendation of the faculty and on behalf of the Board of Directors, I hereby confer upon each of you the degree Doctor of Medicine, granting all rights and privileges and honors thereto. The candidates will now be presented by Dr. Tanya Adonisio.
Will the Doctor of Medicine graduates please approach the stage to receive your diplomas and hoods as I read your names? Nevin Adamski. Dr. Adamski's residency will take place in emergency medicine at Eastern Virginia Medical School. Lauren Nicole Aguiar. Dr. Aguiar's residency will take place in internal medicine at Penn State Hershey Medical Center. Alexia Aguilar. Dr. Aguilar's residency will take place in psychiatry at the University of Virginia. Sean Leo Alventosa. Dr. Alventosa's residency will take place in family medicine at the University of Texas. Caitlin Anderson. Dr. Anderson's residency will take place in family medicine at the University of Pittsburgh Medical Center, St. Margaret's. Kara Ann Anzelevich. Dr. Anzelevich's residency will take place in psychiatry at Atlanticare Regional Medical Center. Benjamin Apple. With distinction in research, Dr. Apple's residency will take place in internal medicine at the University of Massachusetts Chan Medical School. Stefan Inosian. With distinction in research, Dr. Inosian's residency will take place in orthopedic surgery at Temple University Hospital in Philadelphia. Nada Bader. Dr. Bader's residency will take place in diagnostic radiology at the University of Pittsburgh Medical Center. Evan Baer. With distinction in research, Dr. Baer's residency will take place in internal medicine at Yale New Haven Hospital. Caroline Bandorska. Dr. Bandorska's residency will take place in pediatrics at Montefiore Medical Center. Allison Barrett. Dr. Barrett's residency will take place in internal medicine at Brigham and Women's Hospital in Massachusetts. Connor Berry. Dr. Berry's residency will take place in internal medicine at Geisinger Health System. James Basting. Dr. Basting's residency will take place in internal medicine at the University of Kentucky Medical Center. Burke Beauregard. Dr. Beauregard's residency will take place in psychiatry at Tower Health. Michael Blazowski. Dr. Blazowski's residency will take place in emergency medicine at Cooper University Hospital. Rachel Bockel. Dr. Bockel's residency will take place in pediatrics at Albany Medical Center. Bensha Boalam. Dr. Boalam's residency will take place in emergency medicine at the Hospital of the University of Pennsylvania. Yusuf Boregda. Dr. Boregda's residency will take place in internal medicine at St. Luke's Hospital in Bethlehem. Carly Brash. Dr. Brash's residency will take place in internal medicine at Thomas Jefferson University Hospital in Philadelphia. Mark Brown. Dr. Brown's residency will take place in internal medicine at Indiana University School of Medicine. Abigail Burke. Dr. Burke's residency will take place in emergency medicine at Darnell Army Medical Center in Texas. Patrick Callahan. Dr. Callahan's residency will take place in neurology at Geisinger Health System. Evan Michael Calvo. Dr. Calvo's residency will take place in psychiatry at the Hospital of the University of Pennsylvania. Priscilla Canals. Dr. Canals' residency will take place in obstetrics and gynecology at Zucker School of Medicine, Northwell. Matthew Carnevale. Dr. Carnevale's residency will take place in internal medicine at Lehigh Valley Hospital. Rachel Charles. Dr. Charles's residency will take place in family medicine at Rutgers Robert Wood Johnson Medical School. Miranda Chen. Dr. Chen's residency will take place in family medicine at Montana Family Medicine. Misty Chen. Dr. Chen's residency will take place in urology at the University of Pennsylvania Health System. Shui Chen. Dr. Chen's residency will take place in internal medicine at Zucker School of Medicine, Northwell. Irene Cho, with distinction in research, Dr. Cho's residency will take place in pediatrics at Stanford. Sophia Costin. Dr. Costin's residency will take place in family medicine at University of Pittsburgh Medical Center, St. Margaret's. Thomas Cronin. With distinction in research, Dr. Cronin's residency will take place in ophthalmology at Geisinger Health System. Nicholas Zalatka. Dr. Zalatka's residency will take place in internal medicine at New York University, Long Island. Tyler DePalma Shields. Dr. DePalma Shields' residency will take place in pediatrics at Kaiser Permanente in Los Angeles. Carly Dieter. With distinction in research, Dr. Dieter's residency will take place in orthopedic surgery at Allegheny General Hospital. Jocelyn Dialectos. Dr. Dialectos' residency will take place in pediatrics at Thomas Jefferson University, Nemours Children's Health. Megan Elizabeth Dowd. Dr. Dowd's residency will take place in obstetrics and gynecology at St. Luke's Hospital, Bethlehem. Jason Doda. Dr. Doda's residency will take place in psychiatry, Trinity Health, Livonia Hospital in Michigan. Shiva Fakre. Dr. Fakre's residency will take place in dermatology at the University of Pittsburgh Medical Center. Rodrigo Fano. Dr. Fano's residency will take place in internal medicine at New York Presbyterian Hospital, Weill Cornell Medical Center. Adriana Feliz. Dr. Feliz's residency will take place in neurology at the Geisinger Health System. Stephanie Gabelis. Dr. Gabelis' residency will take place in orthopedic surgery at Geisinger Health System. Alexia Gagliardi. Dr. Gagliardi's residency will take place in anesthesiology at the University of Minnesota. Reagan Gallagher. Dr. Gallagher's residency will take place in emergency medicine at Cooper University Hospital. Irene June Ganal. Dr. Ganal's residency will take place in medicine pediatrics at Case Western University Hospital. Guha J. Ganesh. Dr. Ganesh's residency will take place in neurology at the University of Pittsburgh Medical Center. Rachel Gefeisman. Dr. Gefeisman's residency will take place in psychiatry at Montefiore Medical Center. Sean Gilhooly. Dr. Gilhooly's residency will take place in internal medicine at Geisinger Health System. Thomas Gonzalez. Dr. Gonzalez's residency will take place in internal medicine at the University of Pittsburgh Medical Center. Mindy Grusin. Dr. Grusin's residency will take place in medicine pediatrics at Penn State Hershey Medical Center. Donovan Harris. Dr. Harris's residency will take place in surgery at SUNY Upstate Medical Center. Rick Hisiano. Dr. Hisiano's residency will take place in psychiatry, family medicine at the University of Iowa. Jishan Shu. Dr. Shu's residency will take place in psychiatry at Atlanticare Regional Medical Center. Ibua Igodaro. Dr. Igodaro's residency will take place in internal medicine at Baylor. Connor Stephen Johnson. With distinction in research, Dr. Johnson's residency will take place in emergency medicine at the University of South Florida. Rohan Kati. Dr. Kati's residency in pathology will take place at New York Presbyterian Hospital, Weill Cornell Medical Center. Adam Jeffrey Klaus. With distinction in research, Dr. Klaus's residency will take place in emergency medicine at the Mike O'Callaghan Federal Hospital, Nellis Air Force Base at the University of Nevada School of Medicine. Justin Kozman. Dr. Kozman's residency will take place in neurology at the University of Pittsburgh Medical Center. Michael Andrew Kovalik. Dr. Kovalik's residency will take place in family medicine at the University of Pittsburgh Medical Center, Williamsport. Victoria Miller Lanham. Dr. Lanham's residency will take place in pediatrics at the University of Virginia. Mary Lee. Dr. Lee's residency will take place in child neurology at Duke University Medical Center. Rebecca Lees. Dr. Lees will complete her transitional residency at the University of Central Florida. Shinyu Lee. Dr. Lee's residency in diagnostic radiology will be completed at the University of Pittsburgh Medical Center. Laura Lozer. Dr. Lozer's residency will take place in pediatrics at New York Presbyterian Hospital, Weill Cornell Medical Center. Yezong Liu. Dr. Liu's residency in neurology will be completed at St. Luke's Hospital. Wanyan Ma. Dr. Ma's residency will take place in surgery at the University of Pittsburgh Medical Center, Mercy Hospital. Elise Machalik. Dr. Machalik's residency will take place in medicine pediatric at Rutgers, New Jersey Medical School. Mark Mandak. Dr. Mandak will complete his residency in internal medicine at the Medical University of South Carolina. Shahid Munzar. Dr. Munzar's residency in surgery will be completed at New York Presbyterian Hospital, Weill Cornell Medical Center. Brian Anthony Martin. Dr. Martin's residency will take place in family medicine at the University of Buffalo. Bo McCarver. With distinction in research, Dr. McCarver's residency will take place in emergency medicine at Prisma Health, University of South Carolina. Jacob McKenzie. Dr. McKenzie's residency will take place in emergency medicine at WellSpan Health. Joshua Mills. Dr. Mills' residency will take place in anesthesiology at the University of Pittsburgh Medical Center. Frank Money. Dr. Money's residency will take place in internal medicine at Cooper University Hospital. John Albert Cavalier Murray. Dr. Murray's residency will take place in neurology at the Geisinger Health System. Catherine Musto. Dr. Musto's residency will take place in pediatrics at Thomas Jefferson University Nemours Children's Hospital. Alexis Notariani. Dr. Notariani's residency will take place in neurology at Thomas Jefferson University Hospital. Kira O'Connell. Dr. O'Connell's residency will take place in pediatrics at Yale. Oluwaseyi Olulana. Dr. Olulana's residency will take place in neurology at Rutgers Robert Wood Johnson Medical School. Ishimomo Osalama. Dr. Osalama's residency will take place in psychiatry at Zucker School of Medicine, Northwell. Meera Patel. Dr. Patel's residency will take place in urology at Virginia Mason Medical Center. Merlin Paz. Dr. Paz's residency will take place in emergency medicine at Ohio State University. Jacqueline Pod. Dr. Pod's residency will take place in family medicine at St. Joseph's Medical Center. Zane Porterfield. Dr. Porterfield's residency will take place in ophthalmology at SUNY Buffalo. Joshua Quach. Dr. Quach's residency will take place in psychiatry at New York University's Langone Medical Center. Jennifer Quinter. Dr. Quinter's residency will take place in pathology at New York Presbyterian Hospital, Columbia University Medical Center. Clement Rajakumar. Dr. Rajakumar's residency will take place in surgery at Jersey Shore University Medical Center. Antonika Rowena Rajan. Dr. Rajan's residency in obstetrics and gynecology will take place at Tufts Medical Center. Stephen Reel. Dr. Reel's residency will take place in medicine pediatrics at Case Western. Miranda Rep. Dr. Rep's residency will take place in obstetrics and gynecology at St. Luke's Hospital, Bethlehem. Jesse Ritter. Dr. Ritter's residency will take place in internal medicine at the University of Arizona, Tucson. Bianca Virginia Sanchez. Dr. Sanchez's residency will take place in internal medicine at the University of South Florida. Nathan Ortel Sanders. Dr. Sanders' residency will take place in medicine pediatrics at the University of Kansas, Wichita. Lisbeth Sandoval. Dr. Sandoval's residency will take place in family medicine at the Zucker School of Medicine, Northwell. Lena Shawley. Dr. Shawley's residency will take place in family medicine at New York Presbyterian Hospital's Columbia University Medical Center. Hamza Sharif. Dr. Sharif's residency will take place in internal medicine at Thomas Jefferson University Hospital. Richard Parker Shea. Dr. Parker Shea's residency will take place in surgery at the Naval Medical Center in California. Rachel Simon. Dr. Simon's residency will take place in neurology at Geisinger Health System. Benjamin Smith. With distinction in research, Dr. Smith's residency will take place in surgery at the Geisinger Health System. Cecilia Strausch. Dr. Strausch's residency will take place in internal medicine at the Wright Center. Jessica Tang. Dr. Tang's residency will take place in psychiatry at Portsmouth Regional Hospital in New Hampshire. Audrey Valentine. Dr. Valentine's residency will take place in family medicine at ProHealth Waukesha Memorial Hospital in Wisconsin. Niraj V.S. With distinction in research, Dr. Vies's residency will take place in pathology at the Cleveland Clinic. Justina Warnick. Dr. Warnick's residency will take place in psychiatry at the University of Connecticut School of Medicine. Shauna Wasmus. Dr. Wasmus's residency will take place in medicine pediatrics at the University of Massachusetts Chan Medical School. Adam Watkins. Dr. Watkins' residency will take place in anesthesiology at the University of Pittsburgh Medical Center. Mitchell Albert Weber. Dr. Weber's residency will take place in family medicine at the University of Pittsburgh Medical Center, St. Margaret's. Cecilia Jane Weingart. Dr. Weingart's residency will take place in family medicine at Bryn Mawr Hospital. Emily Winkler. Dr. Winkler's residency will take place in surgery at the Medical University of South Carolina. Christine Wojciechowicz. Dr. Wojciechowicz's residency will take place in anesthesiology at the Hospital of the University of Pennsylvania. Mia Christine Wolf. Dr. Wolf's residency will take place in pediatrics at Valley Children's Healthcare in California. Kerlia Yan. Dr. Yan's residency will take place in internal medicine at Allegheny General Hospital. Michael Yee. Dr. Yee's residency will take place in dermatology at the University of Colorado. Jia-Ing Zhang. Dr. Zhang's residency will take place in emergency medicine at Morristown Medical Center. Congratulations to our Doctor of Medicine graduates.
Congratulations, graduates. You may now move your tassels to the other side. Congratulations. Dr. Murthy spoke of remembering the recitation of his oath, and now we will have our graduates recite an oath, committing them to their work in science and service. The words of the oath are found in your program, and all physicians here today, everywhere, are welcome to join in the recitation of the oath as we recommit to our science in service as well. It is our tradition to have the oath administered by a faculty member chosen by the graduating class, and the class of 2024 has asked Dr. Tanya Adonisio to return to administer their oath. It is my pleasure to turn it over to her now.
New doctors of medicine, please stand and join me in reciting Geisinger Commonwealth School of Medicine's oath. I invite all physicians with us today to join. The words are in your program. Let us recite this oath in unison. Today, I commit myself to the calling of medicine. I stand beside my teachers in devotion to the care of the sick, the promotion of health, and the service of humanity. I am privileged to be a part of my patients' lives. I will abandon my prejudices to walk with them on their journey through life and its pivotal transitions. I will hold sacred the bond with my patients and guard that which is intimately shared. I will collaborate with my colleagues in the best interests of my patients and society. I will strive humbly to admit mistakes, make amends, and forgive others in acknowledgement of our common humanity. I will use my intellectual curiosity to water the seeds I have been given and cultivate the growing tree of our medical knowledge. I am grateful for the family and community that have brought me to this day and will honor them in fulfillment of this oath. I will hold myself to the highest standard, maintaining and furthering the ethics, integrity, and noble traditions of my profession. I will be a doctor, a student, and a teacher beyond the confines of the bedside, in my community, and in my daily life. In doing so, I will cure sometimes, relieve often, and comfort always.
Thank you, Dr. Adonisio. And finally, it is time to sing. We will be led in the singing of our alma mater. Thank you to our students. After the alma mater, everyone please remain at your seats while first the stage party will recess, followed by faculty and guests. Graduates, please remain where you are so we can take a quick class photo and preserve the memories of today. Now, the words of our alma mater can be found in the program. All are welcome to stand and sing.